Patients with type 2 diabetes often don't have any symptoms, especially if their blood sugars are not that high.
Patients with type 2 diabetes, they do make insulin, but it doesn't get the job done very well, so they have to make pretty high levels of insulin to normalize their blood glucose levels. Eventually, their pancreas gets to the point they can't really keep up with that demand, and so their blood sugars start to rise.
If their blood sugars are very high, they may experience increased thirst, increased urination, changes in appetite, changes in weight, poor healing from infections.
Other symptoms to be aware of are lethargy, which just means you're always fatigued, always tired. Another symptom that patients do complain about, blurry vision. Sometimes with these excess sugars, it does affect the eyes, so it can cause some blurriness in the vision.
And patients with diabetes may also have a condition called acanthosis nigricans. This is darkening on the back of their neck, under their arms, or in their groin, which is also a measure of insulin resistance.
Most of the time when people come to medical attention, they just feel a little bit off. Maybe they're more thirsty than usual. Maybe they have frequent yeast infections, or maybe they have a foot ulcer that's not healing. Blurry vision usually brings people to the ophthalmologist, and an astute ophthalmologist will bring up diabetes as a possible cause for their symptoms.
So sometimes a patient can come in and they have no symptoms at all, but just with routine blood work, you find out that they do have diabetes. Other times they will come in and they will express that I'm having these symptoms of increased thirst, increased urination, and those are key signs that you have to think about to figure out whether or not this patient may or may not have diabetes.
The American Diabetes Association recommends that all patients over the age of 35 are screened for type 2 diabetes. And if that screening is normal, then they should be screened at least every 3 years for diabetes. Patients who have risk factors for diabetes should be tested earlier and more frequently to make sure that they haven't developed type 2 diabetes.